Hi, Dr. Nami. I see you're online. Hi, Anu. Hi, Jhankna.
Hi, Shruti.
Hi. Hi, Jhankna. Nice to see you.
Same here. Hi, Dr. Nami. Hello, and hello to Anu. I don't know if anyone.
Hi. Hi, Shruti. I'm just
Hi,
going to
Dr.
start
Nami.
the video in a minute, okay?
Sure,
Let
sure,
me
sure.
actually
Yeah,
test it first. Yeah.
yeah,
Is that okay? Oh,
yeah,
I seen that cupboard behind me. So
yeah.
just
That's
this.
good. That's good.
Just
Good. The lighting's great.
thank you. Yeah, I have all the lights, mobile lights in my room here because I'm
Hmm.
doing talks. So
And and you're looking very fresh and
yeah,
ready
I'm
to
rested. I'm happy. I'm happy to be here too. Okay, I just need to add one more thing in the slide, so I'm gonna do that.
Sure,
Anything
sure.
else you need from me, or we are?
No, I think we're all good. As long as your internet connection has been stable lately, we should be good.
Yeah,
If
that's
if you want, send me a copy of the slides just in case your internet drops for some reason.
huh.
Then we can have a backup where you can join via phone and I can project your slides.
Sounds good. Sounds good. I'll do that.
Yeah.
I'll just let me add that.
Okay. Hi Pratibha. Good morning.
Good morning, Shruti. Good
Good
morning.
morning. Nice to see you.
Yes, yes. I've been wanting to join this and something or the other, but today I'm so glad I could. And thank you so much, Shruti, for doing this. So much information on the site we are getting. Thank you so much.
No worries. I'm really glad to see you here, Pratibha.
How are you all? Doing fine.
Good, good. I'm just sad that our AWC classes are over now.
Yes, yes, yes. But are you think you will be joining AWP little later, right?
Yeah, I'm thinking about starting the later this month the AWP program. I haven't signed up yet, but I'm very close to
Wow,
close
wow,
to it. Yeah,
wow, wow. Nice, nice. Yeah, but at least we can connect through this. I'm not, but at least hoping that the group you have created
right.
will be able to
Yeah,
connect. But great, thank you so much. Huh?
yeah.
Yeah.
No worries.
Yeah, it looks
Hi.
so professional. I think all the website and the work, and I think you have very good energy going too on the group. So it's
Yeah,
nice.
it's been amazing. I'm so excited. We're actually going to be coming up on 100 members in our
Yeah,
group soon. So
yeah.
I'm really excited about that.
And how many months has it been since you started this?
We started last year, so around June, I would say.
Huh.
And it's been very organic, like people invite their friends, and I don't really do much to get people to join. It's really
Yeah.
been very organic. I
Yes.
see I see a few more are on now. Hi Christine. Hi Anjana.
Okay.
Feel free to unmute yourselves and say hello.
Hello,
Hi. Hi,
Hi
everyone.
Anjana. Hey, hi Christine.
Nice to see you. Thank you for the invitation and thank you for doing this.
So glad to see you here. Thank you. For those of you who are joining us for the first time, and for those of you who are online, it would be great to actually see a little intro in the chat box. If you could drop a few lines introducing yourselves, where you're based, what you're doing these days. It's a great way to connect with one another in the audience. We'll give it a few more minutes for others to join. But meanwhile, please drop a note about yourself in the chat window. Hi Preeti. Hi Rasamai. Namaste. Hi, Sandy. Good to see you here. Hi, Sarah. Oh, good to see, Christine, that you're based here in Bay Area in Berkeley. Thank you, Rasamai, for those nice comments. Hi, Preeti. Really glad you could make it today. So true, Jhankana. Really, we are so lucky to have all of these tools and knowledge that we've learned that can really help through these times that we're in. Hi, Sandy. Oh, Christine used to live in San Jose. That's good to know. I also used to live in San Jose, but I am now in San Francisco. I see a few more are online now. Good morning, Bindu. Good morning, Chrissy. Hi, Izumi. Good to see you here. Hi, Martha. Aloha. Hi, Shagun. Good to see you here.
Good morning, Shanti. Good morning.
Good morning. Hi, Kirtana. Good to see you here.
Hi, Shruti. Good morning.
Good morning. Hi, Annette. Good to see you here.
Hello,
If you was that Om?
yes.
Hi, Om.
How are you?
Good to see you.
It's a good time to complete your studies, right?
True.
Good morning.
Good morning. Good morning, Annette. If you're just joining in, please drop a little note in the chat window introducing yourself. Tell us where you're based, what you're doing these days. And especially if this is your first time attending a Coming to Ayurveda online event, would love to hear a little more about you and welcome you here today to your very first event. We'll give it a few more minutes for people to join, but please do introduce yourself. And in the meanwhile, I just want to share a little bit about, Coming to Ayurveda and this guest speaker series, in case, this is your first time joining us. Coming to Ayurveda is a community for professionals in Ayurveda, professionals and students in Ayurveda. And we are, we started last year as a small community, of students who started their AWC program at Kerala Ayurveda, and then it slowly began to grow. Some of our online students began to join, some of our AWP students began to join, and then some alumni started to join us. And it's really been very organic, and people have been inviting their friends, and the community has been growing. We now have several people from other schools of Ayurveda as well, Bastyr University, Yoga Veda Institute, and we continue to see, more people from other institutes join. And I think this is a fantastic way for us to get to know others in the community. Especially, I see that a lot of us are, isolated. We don't really have a peer group of people who are aspiring for a professional practice in Ayurveda. So this is a great way to develop a peer support group and get to know what others are doing, and attend webinars like this where experienced practitioners share their knowledge with us. And we really started the Women in Ayurveda guest speaker series in December, and this is now our fifth speaker event. And thank you, Dr. Nami, so much for being our speaker today. So excited. Dr. Nami is actually one of our teachers at Kerala Ayurveda. I've also heard her as a speaker at some of the conferences last year, and I'm so excited that she could join us. She really brings her own flavor of Ayurveda and energy and enthusiasm that I'm really glad that she could take the time to be with us here today. So I know some people are gonna keep streaming in, but I want to make sure that we have enough time to really cover the material with Dr. Nami as well as take your Q&A. So if you have questions, we'll take them at the end of the talk, but please do post your questions in the chat window and we'll make sure to take them. And without much further ado, I'm going to hand over to Dr. Nami. All right.
Hi everyone, namaste. Good morning. It's so nice to see you, to be here with all of you. And on my screen, I have all of your names that are laid out like that. And I feel like this is an army of healers right here. Hi Anju, I've been thinking a lot about you. So I'm going to connect with you at some point after this. Okay. All right. So I have, I think when Shruti and I spoke, it was, COVID was really just beginning to affect us. We were not yet in a lockdown, and and when I wrote up the what I'm going to talk about, there was so much that I was learning about the disease that I wanted to share everything with you. And I realized that we've so quickly needed to learn so much that it needs to be channelized well for it to be appropriately used in our times. I hope all of you are doing well, and I hope all of you are okay. And I genuinely mean the okay. Okay. So we really are together in this, and it is good to have Ayurveda binding us all and bringing us all together. And I hope that in our herd, we'll have more people coming in, because it only seems logical, because Ayurveda only seems logical, and it only seems reasonable to be to carry us forward through this time and beyond, because I think that the world is not going to be the same again. People cannot take for granted nature and what it can do. So while we learn about the abilities of nature, the force of nature, we have to also learn much more about the positive force of nature. And that's what Ayurveda is here to do for us. So with that high level note, I'll start off the talk. Can everyone see me? Can everyone see the slide? Okay, excellent. So I've rephrased the title a little bit, and I want to talk about the integrative Ayurveda framework for infectious pandemics or epidemics. So this is a common framework that that goes beyond COVID, and it would be applicable for many airborne respiratory kind of epidemics that that affect us, that are affecting us now, and that can affect us in the future. Okay. And knowing what many students have learned at Kerala Ayurveda, the AWP program, I've built on a little bit further from the AWP program. And I understand that many of you are at the AWC level as well. So I will respect that and give you some more details so that it all makes sense. Okay. We may or may not be able to go to the absolute technical details for everything that I had promised, but I hope to give us an overarching view and a slight going into the depths. Okay. So the disclaimers first, of course, that this is not a talk about any cures or treatments or managements of the disease, and there have been no trials for COVID for any of the suggestions, right? So all of these tools are things that have been used in the past, and they make sense for us to apply in the current times. Okay. What I think that this talk is about, it's about the dance of biology. And this is our opportunity to learn about it, to befriend it, to support it, and to share it. And this is the best chance that we've gotten, because I think that we are all so much more receptive. Our families are receptive. So we can make, changes together as family and friends, and spread the goodness. Thankfully, technology is really helping us through this time in so many ways that we can spread this information also so well and so easily, literally from our homes. Okay, so I know all the, we've experienced a very large range of emotions in the last few weeks, and one common underlying one is, of course, fear, right? All the insecurities that come up because of the uncertainty of what's going to happen and how long things are going to be and how are things going to get impacted. And for some people, those fears have also been truly mortal. Okay. And people have been going around looking for fixes and quick fixes for their immunity system to boost it up and take some concoction which is going to fight off and ward off the virus, which is all a good thing. And it can only help, But to what extent and how? I feel that we need to understand the problem in a slightly different landscape. So I loved Krishnamurti's thoughts in this. So let us just use the sequence to to reorient our minds. Okay. And it is, Krishnamurti says, reality can be found only in understanding what is. And to understand what is, there must be freedom. Freedom from the fear of what is. That's point number one. Second, freedom from the desire for the answer, for an answer, is essential to the understanding of a problem. Right now, what we're trying to do is we're trying to understand the problem well, so that we can find the answers. We are not trying to look for quick recipes or quick answers. We want to understand the problem first. And if we really understand the problem, the answer will come out of it, because the answer is not separate from the problem. And this truly is the Eastern way of looking at things. And it has worked. It has given many people a lot of peace to grapple and deal with different circumstances that arise in their life and around them. Okay. So just a quick mention about the global scenario. Okay. When we are getting in from that perspective, when we are huddled up at home and we are hunkered down, why is there this need for social distancing? It is to limit our exposure, right? So that we do not, it does not spread that much, and it does not overwhelm the healthcare system. And there is issue of the doctors and issue of the ventilators, right? If you simply put it, you understand that these measures are instated because of the critical need of the end, of a possible end outcome. And we are trying to prevent that possible end outcome. Okay. So to always have that in perspective is crucial while we are doing the social distancing, so that we are not living at home and we are not living at home, ambushed by or overpowered by the fear of what the virus can potentially do to us. This is very critical, because if fear is driving all of our actions, if fear of the virus is driving our actions, we will be in a very, negative mind space, which will be detrimental to our health. So there's a difference between fear and caution, or fear, or understanding of risk, and gently instating practices that make the biggest difference to the problem. To not overdo something, like people sanitizing groceries, right? Or dunking their oranges in soapy water, gosh. So that there are some things which are an extreme. What is an extreme and what is not an extreme? And if you wash every orange for 20 seconds, I don't know how many hours in the day do you have to do other things. So all of this kind of advice that is floating around, and there are millions of views for that, we need to sort of use our reason as to what is the cost for us in our grand scheme of things. Okay, so just a high level note on that. Second, when is all of this going to end? When will we absolutely be okay with it? Is when we found vaccines and antivirals. Okay, but vaccines are the ultimate end of the light currently, right? That's what we are made to understand. And intermittently, before that, before the vaccines come, our best bets to fight currently, which are known, are antivirals and a herd immunity. A herd immunity is a very interesting concept if you're not aware about it. It is essentially that people who are able to fight this virus, who have been able to develop the antibodies, once they go out, they will be going and warding off the virus, because once the virus enters their system, it will not be able to proliferate and replicate in amounts that can be pathogenic, or the ones that can cause disease, or in amounts that can disrupt regular normal function. Okay. So herd immunity is a concept that people are beginning to talk about. But that's what we're going to eventually need to develop. Okay. Now, what does all of this mean for you, right? So you're going from the global level to you. For us, it is important to know a fact. And the fact is that 97.5% of the people are known to return with immunity. So they're going to return back to their normal lives with immunity. So that is a fact. The numbers can change. They've changed according to country a little bit, according to practices, and everyone is trying to make that nearly 100%, right? So that endeavor is on. For us to constantly be aware of that and tell ourselves that if I am going to be exposed to it, that outcome of me, if I'm going to be exposed to it, then 97.5% of the times, I will be back to normal. I'm going to bounce back, right? And so for us to believe that, for me, I'm definitely going to bounce back. It's not going to take me down, right? So that belief, that should be the underlying belief with which you carry on the day. And the underlying belief, the underlying emotion that carries us through the day should not be fear of exposure. And that is my main point. That fear of exposure should not drive our lives. In fact, at a certain point where you say that, yes, I think I'm going to be able to fight this, you'd say, bring it on. Say, yes, bring it on. Okay. Because that's the time, only once you're exposed, and we're going to get exposed. Okay. It's sooner or later, it's a question of time. So you're going to get exposed because the virus is it spreads. How long are you going to protect yourself from it? Right? And the faster we get exposed, once we are immune and we are fighting fit, the faster the herd immunity will develop for the virus as well. But of course, there needs to be a staggered approach, not for the people who are at high risk, but people who are absolutely ojasvi, according to Ayurveda, right? So what are the tenets of that? And this talk is going to be a lot about the tenets of that ojas, and what are the things that we need to do? What are the things that are in our control to make us feel that we can be there, okay? So if you look at this chart, you see that people who are exposed, no symptoms, 30% people have no symptoms, right? And they immediately become immune. So they are the luckiest. Some people, 55% of them, will experience some amount of mild to moderate symptoms, which also I think is a good thing, because that will tell them that they've been hit by something, okay? And it's in the second week that the symptoms will begin to go away. So they will suffer from it, some uneasiness for a week. For people who are whose immune systems are wonky, which are overreacting, they will begin to get more complicated from the second week onwards. So that's when the hospitalization phase would come in, that, okay, people in isolation, they need more help. From them also, after the third week, immunity kicks in. Okay. For some 5% of the people, the immunity, they might need end stage care. And this representation is not appropriate of the pink, because it's not that they go directly into ICU. They will get into a hospitalization phase and then get into ICU in the later phases. And then in that also 2.5% will develop immunity the third week onwards. Okay. So this outlay is important for us to understand the staging. Okay. This is not to scare us or induce any fear, but this is to induce hope, because all of this green is a reality, right? So if we have to understand why it is that COVID progresses to the severe manifestations. So from what I'm seeing and reading about, it seems that the people who are at the early stages, who have a reduced immune response, okay, that allows the viral load to increase a little bit more initially. And then in the later stages, the immune system becomes overreactive. So all of the symptoms and the negative complications, the negative consequences that we see, they are out of the overreaction of the immune system, which tells us a very important aspect. It tells us that immunity is a very dynamic process. Immunity is a process. It is not a chemical. It is not a certain protein alone. It is a very complex network of the body's responses that are trying to keep it stable. Okay. We'll talk more about that later on. But this understanding of what immunity is not a thing. It is not a material. Okay. So that is point number one. So what is happening? Coming back to what is happening in the second week. In the second week, if people who are exposed do not recover, then the body is overactive. So it is creating in a lot of these cytokines, which have negative consequences on the microarchitecture of the vulnerable organs. In this case, they are the lungs that are affected. Okay? So you have the cytokine storm is the word that they use for it. And the cytokine, the system is flooded with all of these immune reactions from the body. So interleukin 6, interleukin 1, interferon gamma, C-reactive protein, tumor necrosis factor, TNF alpha. All of these are the ones that are found in very high levels in the patients who are becoming more and more serious. Now, whether they are causing the symptoms or whether they are led to by the or they lead to the symptoms, or they are a consequence of the, sorry, let me rephrase that, whether they are causing the problem or whether it is the environment of the body that is creating them, that becomes a question. And this cause effect play is something that we have to understand when we are looking at what is happening so quickly in the human body on a day-to-day basis. So whether it is the virus or whether it is the immunity or whether it is the body's response mechanism, okay? Whatever it is, whatever is the cause, the fact remains that if there is a symptom, if the body is not functioning, that means that there is something called as pathogenicity, okay? Something that can cause a problem. So there are some figures and charts that are beginning to come for how these markers are increasing and how they are behaving as the days progress. So if you see the people who are in red, so if you, okay, I'll start with the people who are in black. The people who are in black, they are the ones with a very positive outcome where the immune response has not been very rocky for a particular protein, okay? And it has, as the days progress, it has danced along well, the immune response has danced along well, and the person has become okay. For the people who are in blue, they are the ones vis-a-vis this protein, they are the ones who have gotten critically ill, okay, and they eventually recovered. And the red are the ones who have not recovered, okay. So that has been the most negative consequence. So there's been mortality with the red. Now, as this data comes in, we understand these proteins. I believe, this is my hope, and I believe that we have some very good, we do have very strong agents apart from ventilators that will be able to manage this or quench some of the cytokines in the critical care stage. And I do believe that once the doctors have more ability to experience and share and communicate, they will have a very strong tool in their very strong tool set for which of those drugs are working to take care of this reactive immune response, okay? So we have drugs used in autoimmune conditions, severe allergic states, and some very strong anti-inflammatory drugs, which will be useful in this later on stage. I don't know if you remember, there was a scare, and there is not a scare, but there was a caution about not to use ibuprofen, right? That France had found that people with ibuprofen, they were not able to fight the virus that much. And there is no substantiation for that claim, and they have taken back that caution, okay, that it is okay to use. They try to avoid using ibuprofen in the early stages, but it doesn't seem to be really that linked in a cause effect kind of a way, okay. But if you see, though, that ibuprofen is a very strong anti-inflammatory. So if it is used early stages, there is a likelihood that the normal immunostimulant response can be slightly compromised. But later on, at the later stages, that kind of inflammation can be controlled by these drugs, which are used not for infectious diseases, but for diseases where the immunity has been creating a lot of problem in the body. So we have, a lot of rheumatoid arthritis and all of those kind of conditions, autoimmune conditions. So this kind of a response is known, okay? It's just about us finding out the right way to fight it. Now, again, why I felt this is important to share with students of Ayurveda is to tell them that immunity is a dance, okay? I want to keep reiterating that through all of these examples. It's not for us to treat, it's not for us to suggest anything, but to share that the inklings that it is a dance. So while I was studying the early stage response, what I told you about was a late stage response, also to tell you and talk about, thrash out all of what if worst case scenarios and a little bit of feedback for you to mull over and for you to have open up that world if you want to, if you need to, for anybody around you. I wanted to introduce you to the worst case scenario, because only once we know the worst case, then we go back and we are able to freely talk about what we can do without fear. Okay, that's my approach and thinking about most situations. So that's my Dr. Nami's flavor for Ayurveda. Okay. So once that's taken care of, let's talk about early stage. Early stage, what is happening? You have a protective immune response. Okay. And I call this protective because it is a response that does not allow the virus to set in, to replicate, for the load to increase. Okay. Now, vis-a-vis coronaviruses, there's, from the history of the SARS coronavirus, when they studied the immune response, there was something called as a NLPR3 inflammasome, okay, which was implicated in that immune response. So if we see which are the useful immunostimulants to be taken for such coronaviruses, then I have made a list, which is all again research back. And those are the ingredients, those are the inputs which seem to have some sort of scientific validation for a positive protective immune response. Okay, so from all of everything else that we are taking and doing, this is a curated list. There can be others also that can be added, but have not been tested in that scientific model, so they do not come in here. Now you'll find a lot of information about these everywhere else, so I will just leave you with that list. Okay. You don't need to understand the details of this inflammasome, but if you wish to understand the immunity response truly vis-a-vis corona, that's your place to go. This site shows essentially about how there's a trigger in a cell and what is the cascade that it leads to, one thing leading to another. And there's production of different kinds of proteins and different kinds of antibodies and cytokines that will help to take care of the contagion. So what is good from an immunostimulant perspective initially we do not have to continue that immunostimulation if symptoms develop or they progress. And particularly 3 of these they are the ones that we recommend that you stop as soon as there's onset of the inflammation, onset of the infection, and that's elderberry, echinacea, and vitamin D3. Elderberry and echinacea, I think you can use. I feel you can use for up to 3 days after these symptoms start, because they will help still to fight it off. But vitamin D3 should be stopped immediately, because D3 is a very good immunostimulant, okay? Now, when I was studying about these immunostimulants that people are recommending and people are taking, you wonder sometimes whether they want to reduce the response. When do they want to reduce the response? At which point of time does the at which point of time the symptom is caused by the virus, and at which point of time the symptoms are caused by the immune response? When does it change? Because we all want good immunity earlier, right? But at some point it changes, okay? So I like this I like this picture for immunity of the boba doll, because whatever is the impact is going to come back on again. So I like it to represent immunity and resilience. So immunity, truly, this immunity, it's all about being calibrated, being timely, being optimal, okay? This immunity plus the resilience. When you say resilience, immunity is the ability to ward off. Resilience is truly the ability to remain stable regardless of an external factor. And vitality is to still bring your most vibrant selves, okay, your most energetic, vibrant cells. So all of this combination, this is a combination of ojas. And that's what you have all learned about, you've all heard about, right? It is a very dynamic process. And its dynamism has to be embraced wholeheartedly. It's not about fear, but it is to respect and understand that it is a dynamic process. Okay. Just over here, I would like to make a note on gag reflex, because later on I will not have an opportunity to. I don't intend to simplify this process at all. It is a very complex process, but in one simple, dynamic way, by a dynamic practice, if we can influence it, if there's one practice that respects this dynamism, there's no product that respects this dynamism, but there's one practice that respects the dynamism, and that is the gag reflex. To, gag in the morning after you have brushed your teeth. So you do it 2 or 3 times. You can stick in your finger or the back end of your toothbrush. And because of that, the vagal nerve gets stimulated. The vagal nerve is an immune nerve. It is a parasympathetic nerve. And when you stimulate it, parasympathetic nervous outflow exists. And to counter it, a sympathetic outflow also exists. And the autonomic nervous system gets stimulated. And that also has immunity benefits. So it releases and makes all of these chemicals that you want your herbs and your supplements to make. and you immediately see a difference in your, you experience some symptoms. You will water, um, you will, there will be nasal discharge, or there will be, essentially, your nasal paranasal sinuses will also clear up. Okay, so that is just one symptomatic immediate outcome, but internally it is generating a lot of these proteins that are good for you. Okay, so this dynamic process, okay, that we talk about, in its full glory, it is an outcome. We have to remember that it is an outcome, it is not an input. The inputs can influence that outcome, but they cannot determine that outcome. Okay, the determination is a mind of its own, and we have to allow that mind of its own to work hassle-free, to work without any weight. So ojas is an outcome. What is it an outcome of? Some of you who have taught earlier might have seen this slide. But it is essentially the Agni, it's essentially a process of the entire digestive metabolic transformations. So the food that you eat, when it gets well digested, it goes through this sequence that you're all very well aware about, of all of the tissues, and eventually it leads to ojas. Suppose this Agni is not well, the food is not going to get digested, it is going to generate ama. Now we are talking about this from a very physical level, but you know and you understand that something that starts at a very physical gross level, how it starts becoming more and more energetic, more and more subtle, and ojas is that subtlety. Okay? But what is within our control? What is within our control? The first things right, first step right. That is the physical. We have that entire avenue open to us to influence this process. Okay. So things that are not well digested, they cause ama, right? And that ama is what I feel that is our biggest target for community health in our current times. This is the opportunity to give everybody the tools to manage ama and talk about ama. Okay, because if ama is not there, then this entire process on the right side will remain intact, and it will naturally hurtle towards ojas. Okay, and that's what we are seeing. That's what we are seeing for people who are able to come back and recover and be resilient. Okay, that is a natural process. Before I get it, I wanted to know, can you give me a blurb on how much time I have? I'm sorry, I lost track. Okay, I don't see that coming.
Hey,
I think
Dr. Nam,
yeah.
can you hear me?
Yes.
I was thinking that you can definitely take another 10 to 15 minutes, and we can also extend the session a little longer if you have some time and if people can stay on for the Q&A.
Okay. All right. Okay, thanks. Yeah. Okay, thank you. So when we come to this ama, you're all Ayurvedic physicians, but suppose you share this talk with anybody else also. I wanted to give an idea about ama very quickly, and I use the bomb calorie meter. Okay, the bomb calorie meter is a tool that they use to understand how much energy a food produces. Okay, how much energy does a food produce? And they burn it completely. They burn it completely and measure the amount of heat that comes out. Now, that's not how our bodies burn it, right? The bodies will burn it to different extents depending on the amount of Agni that's there inside. Now, suppose this food is not burnt completely, it will lead to some residue that remains in the bomb calorie meter, and that is the kind of ama that exists in the body also if it is undigested. Now, this ama, it is sticky, it is heavy, it is lubricated, it also has some increased water, okay? And it also has some increased water. So this biophysical property of ama has to be understood well, so that we are able to create an environment where it does not exist. This not biochemical, but biophysical property of ama has to be understood well. Because that biophysical property of ama, once we change, we can change many outcomes. The way in which I see Ayurveda, and it is about how things progress. So once you have a dravya, when you have a biochemical or a biological or a material entity, okay, that interacts with our system, it has its biophysical influence in terms of its hot, dry, the gunas, right? The hot, cold, dry, lubricated, light, heavy gunas, and the 20 sets of gunas. And those gunas, they change the environment and they affect the biomechanics, the flow in the body. Okay. And the flow impacts, it is this flow that once it is disrupted, the channels, when they're not behaving okay, when there's disruption, that's when disease sets in. So that's something that we need to bear in mind. So what is our opportunity? Our opportunity is to change the biophysical environment, because we may or may not always be able to influence the biochemical or the biological environment too much. It's not too much, it's not in our control, because externally the world has so many of those inputs which we will have to interact with. But what is in our control? Biophysical is in our control. Okay. So I want to make a bold statement. And that statement is that there is no fever without ama. This is a bold statement. What does this mean? That means that the body is not going to get into a systemic response, which has been documented to occur in most of the cases vis-a-vis the current epidemic. It is not going to get into a systemic response if there is no ama. I think that this is huge. The importance of this is huge. Why is it that fever is needed for ama? Why is it that these two are related so intricately? We must understand the fever. Ayurveda sees fever as a body's response. Response to what? When the system becomes suddenly overladen with ama and it cannot do its job well, the Agnis, with the subtle Agnis, are not doing its job well. They're not able to take care of the flow and the dynamics. That's the time the Jataragni, the Agni in the stomach, is going to be sent out. It's going to be sent into the body, into all of the dhatus, and it's going to close the shop of the stomach. They say that, okay, no more eating food. The Jataragni, you go into the channels, into the subtle channels, and you are going to gently dry roast the ama off. Okay, remove the ama by burning, by sending something very potent. So you close off the sweat channels, you send the Agni out, so you're creating a little furnace to take care of the ama. Once that job is done, the sweat channels will open, you will sweat, and the fever will release, and gradually there will be a return of appetite. Okay. So this is the dynamic process for infections. So once we understand this is in our back burner. If we want to try and put down a Shat Kriyakal, the 6 stages of disease that Ayurveda talks about. If I wanted to put the big chunk, I would say prodromal is normally the stage, but I'm trying Shat Kriyakal a little bit so that we have more room to talk about the later stages. So, and the acute respiratory distress stage. Okay. So up to here, up to the first three, things are in our control. That's when we are doing prevention. And if the symptoms set in, we do Ayurvedic fever management, which means not to take any Tylenol initially, and to help the body reduce the ama by using medicinal herbs, not spices, but medicinal herbs, which are really bitter, which are like Kayachikitsa and all the components of Sudarshan. Okay. Now, these, before fever sets in also, Ayurveda says that there is a symptom subset that's going to emerge. We may or may not have testing. I don't know when we are going to have testing for the current virus, but we have the symptomatic manifestations. And what are those symptomatic manifestations for prodromal fever conditions? So you have heaviness, you have fatigue, you have indigestion, loss of taste, watery eyes, some burning sensation, loss of strength and color, out of character behavior. That's very peculiar. Now we are in closed settings, we will know, people are behaving off. Right? They do not respond with the same energy and the zest. Dislike for wind, water, and heat. Some of these things are coming out even before fever sets in. You know that, okay, I need to get onto a fever protocol. So I would expect us to preempt that to take care of the ama. Key ama reduction strategies would be, I'm summarizing them, which I think would be the most important to think about. Everything is that's hot, dry, and light. So hot water, dry ginger, CCFT, not to eat when you're not hungry. Now, exercise is similar to fever because exercise also helps to sweat out all the ama from the subtle channel so that the fever does not need to do the same job. So being able to do some sweat it out kind of exercise at least one or two times in a week, if not every day, would be a good idea. Eating light, digestible foods, eating 3/4 of your capacity, right? And there are medicines that exist, and you guys are all experts by now. So, or if you're not, you approach a Vaidya who is in your vicinity, or well, vicinity doesn't matter anymore. So approach a Vaidya anywhere with your particular sets of symptoms and create the right blends for you. So our role is to keep the Agni kindled, the ama down, the Agni kindled so that Ojas will be formed. You all know about what are the characteristics of a rightly kindled Agni. If I have to put top 4, there will be feeling of hunger at appropriate times, feeling of lightness, formation of good stool, feeling general energetic. Anything beginning suboptimal, you will have lack of appetite, heaviness, lethargy, brain fog. Or when it leads to ama, sticky stools that sink, or a heavy coated tongue. I don't want to stay on this because we don't have much time, but you can read this later. I just want to share vis-a-vis the Agni that we have to keep the Agni kindled. There are things that we can influence and we cannot influence. The non-modifiable factors are season, age, prakriti, and some disease states that need treatment. We cannot directly influence. Modifiable factors are food, sleep, emotions, and exercise. And these green are the ones which are our avenues for response. And I would put in emotions there as well, because emotions and Agni are very linked. Not just directly, but also because they influence our behavior and our choices, and that has an impact. So exercise, I've made a note, shared about why it is important for sweating vis-a-vis the jvara. But the other side, I wanted to say that, people who, I'm noticing a lot of people who are sleep deprived and they still exercise, right? They prioritize exercise over sleep. And that's okay as long as they feel rested. But if they don't feel rested and they are trying to do the exercise, it becomes a drag on the system. It's not something that Ayurveda recommends. So sleep becomes a bigger priority, and sleep is truly the only dynamic natural process from the modern medicine perspective, or the modern understanding, emergent understanding perspective, that, sleep has a major role in immunity. And that's the first thing everyone has been recommending, with very good reason. Okay, so there are a lot of studies for sleep and immunity. And going one step further from sleep, it's not the amount of time, but it is your feeling of being rested. Okay. Now, the feeling of being rested is something that is influenced by your emotions, by your society, by your behavior, and all of those choices. So doing things that take us to that, thinking and living in a fashion that generally allows us to remain restful for as many hours as possible. Anything that causes us to not feel restful, to examine how we are doing that, why we are doing it, do we need to do it, how are we doing it, can we do it better, anything that drains us, that would be a very crucial input at this point of time. Okay. And then you have some things that we are not able to deal with cognitively. How do we use breath work, and how do we use pranayama to allow us to make better choices and release any negative pent up energies? So use pranayama as a tool, not as a regular practice. I do pranayama every day. No, not as a practice. But remember to use it at any point of time during the day when you feel unsettled. So you can write, you can use pranayama. You can use pranayama to examine your mind as well. Ayurveda says people who live with awareness and a grounded lifestyle, they need no rasayan or supplements because they are naturally ojasvi. So that is that is a strong message that I want to give, so that we are not only stuck in the quagmire of products or recipes or quick fixes or things that we can do as teas. this problem, it's a larger problem. It's a more real problem. So let us use all of these tools of Ayurveda to approach it in a way that it works in our favor. Okay. That's what the emphasis for this talk has been about. And this is not about empty reassurances. This is not about negating any threats. It's not about any of that. It is about reality and how are we going to deal with and how are we going to cope with this reality. On a slightly tangential note, apart from the things and practices that we do for ourselves and how we behave and how we interact, I wanted to share that epidemics in Ayurveda have been mentioned as Janapada Upadvansa. They have been described, and contact and removing contact and all of these practices have been talked about. But another dimension that has been talked about is that why people suffer. Why does Janapada Upadvans occur? In that there is a comment about it being the actions of a people, that the karma of a people that gets them, that needs them to face this. This is not to sound morbid or anything like that, but essentially it allows us to reflect on our practices for each other as well. And the chikitsa, the treatment of Janapada Upadvans, is charity, kindness, taking care of all living beings around you, including the animals and the plants. To be able to do homa and yagna, and again learn to surrender to things that are beyond our control, agents that are beyond our control, and to respect everybody's world. And it's amazing that I do see humility, sensitivity, and kindness coming from all quarters at this time. And I think that we are responding in a very beautiful fashion. I hope that it sustains such that, it changes the future times that we may or may not have to endure like this again. I want to end with a note for, as a prayer for world health, which I love absolutely. And I'm going to say it. Okay. So, Om Swasti Prajabhya Paripalayanta Nyayena Margena Mahim Mahisha Go Brahmanebhya Shubhamastu Nityam Loka Samasta Sukhino Bhavantu Kale Varshatu Parjanyah Prithvi Shashishalini Desho Yam Kshobarahitah Brahmana Santu Niramaya Nirbhaya. Thank you. Thank you for a patient listening. And I'm happy to take questions.
Thank you so much, Dr. Nami. That was a very, very interesting and fascinating topic. Thank you so much for sharing all of your recent research and thoughts around this topic. I learned a lot of interesting new areas for me to explore further. And we do have some questions here in the chat window. Okay. So maybe I will read them out.
Yeah.
Okay. So the first question was from Purnima, who was asking about, people with autoimmune conditions. I think she was trying to understand about immunity, like how does the idea of immunity work for people with autoimmune conditions?
Yeah, it's a tricky situation. Thank you everyone for the uh, so for autoimmune situations and people who are in immunocompromised states, so people who are taking chemotherapy, uh, it is at the initial stages, though their drugs are not helpful. Their drugs are helpful only once a cytokine storm is going to come in, if at all, and hopefully not. But for them, I think if they're taking any immunity reducing herbs, they definitely should take some immunostimulant supplements. Okay. Immunostimulant supplements are not necessarily needed for everybody. They are not necessarily needed for everybody if the Ojas and Agni are okay, right? But these people, they should get advice from a Vaidya or one of the practitioners and get some boosters in their system, and ensure that they are taking care of their sleep cycles and all of that well. And in general, just like how we take more care for the elderly, take more care for the autoimmune states as well.
Okay. Another question was about any guesses as to whether the
Okay, I'm there. I got that. I got that, Shruti. So I'll read it aloud.
Sure.
Shruti says, well, any guesses as to whether these instruments work better for people with certain constitutions? Would it be better for Pitta? That's a very good question. I think that, I think that more than constitutions, we should see that some of these immunostimulants, what is their impact on Ama and Agni? And whether, Guduchi would be like how the immunostimulants that take care of Ama, I would prefer them for certain people with more Ama. And constitutional wise we can do it, but it is very complex to make simplistic categories, I feel. And I'm sure that people would do that, but I've never been a very big fan of that, because I think that if we don't focus on the Agni and Ama, then the point is moot. And Agni and Ama itself take up so much energy, and they're simple, and they're and yet they take up a lot of conscious thought, right? So prioritizing that is more important than the categorization. And the other thing is that once any person's natural Agni state is established, the balancing the Agni does on its own, right? So balancing for any dosha imbalances, it will do, and then it will tell the body that, hey, send in something sweet, or send in something bitter, or send in something. So it will be a gut feel or gut response. And if you're aware and you respond to that, the doshas are managed very well. As long as the Agni and Ama are good, and you think you can trust what your Agni is telling you, then the doshas are taken care of. Okay. Jagna asked, the two immunostimulants, elderberry and echinacea, you mentioned, are these traditional Ayurvedic herbs? No, they are not. They are not. But elderberry is used very frequently. And, because this is an integrative Ayurveda session, it's about, also about the inputs that people use very frequently. And nothing is traditional or not traditional. According to me, nothing is Ayurveda or not Ayurveda. As long as we are able to understand its Ayurvedic properties and Ayurvedic impacts with vis-a-vis the guna, karma, rasas, then we are able to use it in an Ayurvedic context, right? The Ayurvedic context of the use of supplements is different than just using one common thing for everybody. They're very popular as supplements. Okay. Marina asked me if there is a separate protocol for women who are pregnant or babies whose immunity is already low. Well, I have not given any, conscious thought to that. I don't know. I did see some article about what's happening vis-a-vis COVID and pregnant women. And some people who have advised initially are also about starting some of the immunostimulants as a proactive advice. Okay, so beyond that and beyond what I have shared, I don't think that there is anything that I can generally say. And babies whose immunity is already, well, babies are building their immunity on through their mother and with their mother. My concern for newborns is babies who are born through C-section and mothers who have lactation issues. Okay, those are the babies who will need to be really protected, reduced, to not allow exposure to occur for the next few months, and they will be of concern. Pregnant women are in general, more robust than many of us, so I'm not worried about them in general. And if they are lactating mother breastfed babies, they both would be okay as long as they are in a safe, clean environment. So they are not the people who I would say that a little exposure is, if they're fighting fit and a little exposure is good. No, of course not. Okay. Anu says that I heard in the WHO briefing that 80% mild moderate cases include 40% moderate cases managed at home. They have pneumonia. How do we handle that? Yes, because pneumonia is going to set in the second week. So it can, if it's not resolved. So pneumonia management in Ayurveda is a different chapter. It's a different approach altogether. I feel that pranayama and deep breathing exercises should be started right at the start. Okay, there are a lot of breathing techniques that people are talking about, and I feel that if it is a small airways that need protection, we need to do a lot of the expiratory pranayama very well, so that the small airways compression occurs. Now the thing is that if the expiration is okay, inspiration is going to happen naturally because of air pressure and breathing. What is the problem pressure-wise is sending the air out. So that has to be a more conscious training that we give right from the start of the onset of the symptoms, if not earlier. Okay. Now, Art of Living has a very good Bhastrika practice that I really like. But Bhastrika is really the, Kapalbhati and Bhastrika are the two breaths that affect the expiratory part, right? So you're right? That's the Kapalbhati, where you're just actively exhaling and passive inhalation. Bhastrika is active inhalation and active exhalation. So you are, right? So that is Bhastrika. Now, when you do it with the hand movement, that's the Art of Living style, you're opening up the sides of the Parshva. That's what Ayurveda calls. Okay? You're opening up the Parshva and the air goes in there as well. And you're keeping the drum moving well. That is first. Second is pneumonia can be managed with Ayurvedic drugs internally, and those people should definitely seek Ayurvedic advice. But commonly, if they have to additionally do something, they do a lot of steaming on the chest apply a little bit of oil and salt and steam the chest. Oil and salt and steam the chest. Oil and salt is needed to transfer the heat very well. So heat it up at the time when there is no fever. Okay, I don't know how many such windows exist during the day once the symptoms start. But when there is no fever, you heat up the chest so that the body does not have to bring in the fever as well. And this is something that you can start preemptively in the first week as well to protect the chest. Okay. And I think we will need to design a respiratory protocol for them. There are 2 or 3 documents floating around. Some Vaidyas have come together and prepared some, formulations for different stages. And I've been looking at what's happening stage-wise from a traditional Chinese perspective, Chinese medicine perspective, what they've documented, and maybe we can use that to put in the Ayurvedic formulations. I've not found time to do that bit, but maybe we will do it over the next few days or weeks. It is definitely a concern. There's something also called as Alissi flaxseed lape, okay, that was used to put on the chest. So you crush the flax seeds and you make a paste, sticky paste. You put cotton over it and then you do the heat pad. That's what we use for pneumonia. I would also highly recommend people do Vamana in the first week to remove out the excess phlegm. Vamana has to be used for prevention gagging, and once the disease sets in, you have to use Vamana. Okay. Anu, yes, women with COVID can and should breastfeed. I think so. Okay. Hi, Preeti. So, Preeti, about conflict with vague udaran, no, it would not, because, it is not Vamana. You're not actually retching. You're only doing a little gag. So, it's a little stimulation. And that's what actually even the Vamana practice does, right? It's a therapeutic, but it is more intense. Okay. So, like, for example, you would say that, okay, giving a laxative can also conflict with vague udaran, right? So, okay, when an individual heals themselves. Shruti asks, when an individual heals themselves, they are said to develop antibodies and it's COVID, ensures they don't get a disease again. We don't know that yet. We don't know whether the antibodies are going to be good enough. The antibodies pass from one individual to another. No, they can't. They can't. Everyone needs to make their own, except a mother can pass on to the baby. And that's why it's okay for mothers with who are breastfeeding infants, mothers with COVID breastfeeding infants, they will pass on the antibodies, right? You only get it from your mama. Okay. Anu, well, Anu, whether it will go away or whether it will resurface, that's not the question. The question is our ability as systems, as individual systems, as community systems, as family systems, as community systems, as even professional systems, and how businesses are set up to be able to be aware that we need to create entities that are resilient to such threats, right? The name doesn't matter. That's Ayurveda. Okay, so I think I've answered all questions, and thank you so much for your kind. Thank you, Tatiana. Thank you, Tatiana. Love you guys, and be safe, okay? And be happy.
Thank you so much, Dr. Nami. Fascinating session. Really enjoyed it. And thank you for staying on a little longer, to you, Dr. Nami, and to the participants to cover the Q&A. If you have more thoughts and comments, please feel free to reach us. Dr. Nami, maybe you can post your questions to Dr. Nami after the session in the WhatsApp group, or you can probably look up her contact info from her website as well. What does that make sense, Dr. Nami?
Yeah, I may not be able to respond to the WhatsApp that much, but whatever is impactful and whenever I can, I definitely will. So you can post it there and I'll try to answer.
Okay. Thank you so much. Thank you everyone for making it today. Thank you once again. Really grateful that you all could be here today. Thank you so much.
Okay. Bye-bye.
Bye. Bye.